Hello, everyone, and welcome. Today, we're touching on a subject that holds profound importance for each of us, our health. Specifically, we're delving into lung cancer, a formidable foe that stands as one of the leading causes of cancer-related deaths globally. It's a topic that might feel distant until it touches us directly, but awareness is our best defense. The journey towards combating lung cancer begins with knowledge, particularly early detection. Often, the signs of this illness whisper before they shout, making them easy to dismiss. That's why recognizing these whispers can be the key to timely intervention, which significantly enhances the chances of successful treatment. In this video, we'll explore 7 early signs of lung cancer that are too crucial to ignore. Each symptom we discuss today is a piece of the puzzle in understanding and potentially catching lung cancer in its early stages. So let's start this important conversation together and arm ourselves with the knowledge that could one day save lives. Number 1, persistent cough. Let's dive into a symptom of lung cancer that many of us might overlook: a persistent cough. Imagine you've had a cough. It seems like just another seasonal annoyance. However, if it lingers for more than 2 weeks and doesn't show signs of improving, it's time to pay closer attention. A cough associated with lung cancer isn't your typical cough. It doesn't just clear your throat. It's persistent and often intensifies rather than fading away as you might expect with a common cold. This type of cough can be dry, or it might produce sputum, which is a mixture of saliva and mucus. The key here is its persistence and gradual worsening. Why does this happen? Well, as a tumor develops in the lungs, it can irritate the lining of your airways or obstruct the flow of air, triggering a cough. This isn't just an ordinary irritation. It's your body signaling that something is amiss internally. It's crucial to listen to what your body is trying to tell you. A persistent cough that seems out of the ordinary deserves attention. It's not just about discomfort. It's about recognizing a potentially serious underlying issue. Remember, lung cancer might not shout its presence. It often starts with such subtle hints. If you find yourself or someone you love in this situation, observing a cough that just won't quit, please consider seeing a healthcare professional. Early detection can make a significant difference in treatment options and outcomes. It's a simple step that could lead to early intervention and might just be life-saving. This isn't about causing alarm, but rather fostering awareness. Your health is invaluable, and understanding the signals it sends can be your first line of defense against illnesses like lung cancer. So take that persistent cough seriously. It's worth your attention. Number 2, changes in breathing. Now let's talk about another subtle but significant sign of lung cancer: changes in breathing. It's something we might easily dismiss as just being out of shape or a temporary hiccup in our health. But when your breath doesn't catch up, even after mild activities like climbing a few stairs or walking to the mailbox, it's time to take a closer look. Breathing changes related to lung cancer can manifest as shortness of breath or a new noticeable difficulty in catching your breath. You might feel as if you can't get enough air, or you may notice yourself becoming unusually winded from tasks that you used to handle with ease. This isn't about the breathlessness from an intense workout. It's more profound and occurs during everyday activities. Why does this happen? As lung cancer develops, it can block or narrow an airway, or fluid from a tumor might build up in the chest. This impacts your lungs' ability to expand fully and deliver oxygen efficiently. The result is that feeling of being short of breath. It's essential to understand that these changes in your breathing pattern are more than just inconvenient. They could be signals from your body that something serious is going on. If you or someone you know is experiencing these changes in breathing, particularly if they persist or worsen, it's important to consult a healthcare provider. Identifying the cause early can open up more effective treatment options. This conversation about breathing isn't just clinical, it's deeply personal. Our breath is our life force, and any change in its rhythm deserves attention and care. Let's keep these dialogues open and attentive to ensure that we're not just surviving, but thriving. Number 3, chest pain. Shifting our focus to a more direct signal from our bodies, let's discuss chest pain, another critical early sign of lung cancer. When we talk about chest pain in this context, we're not just referring to a fleeting discomfort. We mean a persistent pain that may arise when you're breathing deeply, coughing, or even laughing. So, what exactly does this type of chest pain feel like? It's often described as a dull ache or a sharp pain that doesn't go away. It might come and go at first, but tends to become more constant as time progresses. This isn't just a random occurrence, it's your body sounding an alarm that something might be wrong in the lung area. Why does this happen? The pain is typically caused by the growth of a tumor that presses against nerve endings or invades into the chest wall, irritating the pleura, the lining around the lungs. It could also stem from the tumor causing a blockage, leading to a buildup of fluid which puts pressure on the chest. This symptom is particularly concerning because chest pain is often associated with critical conditions, not just lung cancer. That's why it's essential not to ignore this pain or write it off as something less serious like muscle strain or heartburn. If you're experiencing this kind of chest pain, especially if it's new or has changed in character, it's crucial to seek medical advice. Early diagnosis can be life-changing, opening up treatment options that might be less invasive and more effective. Addressing chest pain early can connect you to the necessary medical evaluations and interventions. Remember, acknowledging these signs isn't just about medical treatment, it's about respecting your body's messages and caring for your health proactively. Let's keep these conversations open without fear to ensure we're not overlooking vital signs that could save lives. Number 4, unexplained weight loss. Let's turn our attention to a symptom that might seem like a blessing to some, but is often a red flag for health professionals. Unexplained weight loss. When you lose weight without trying, without changes to your diet or exercise routine, it's essential to consider why this might be happening. Unexplained weight loss can feel initially gratifying, especially in a culture that often celebrates being thin. But when you're shedding pounds without any effort, it might be your body signaling that something is amiss. In the context of lung cancer, this symptom is particularly concerning because it suggests that your body isn't absorbing nutrients effectively, or it could be that the cancer is using your body's energy resources. How does this relate to lung cancer? Tumors require energy to grow, and this energy can divert nutrients away from normal body functions. Moreover, cancer can increase the metabolism rate of your body, causing it to burn calories faster than usual. This kind of weight loss is not healthy. It's a sign that your body is under stress and struggling. The emotional impact of watching your body change in this way can be distressing. It's not just about aesthetics. It's about recognizing that these changes may signify something serious. This is why it's crucial not to dismiss sudden weight loss as a lucky break, but to view it as a reason to consult with a healthcare provider. If you or someone you know is experiencing unexplained weight loss, it's important to take action by seeking medical advice. Early detection can make a significant difference in managing and treating potential illnesses, including lung cancer. Remember, understanding and responding to your body's signals isn't just proactive, it's an act of self-care and respect. Let's not ignore what our bodies are trying to tell us. Number 5, recurring respiratory infections. Now let's talk about a symptom that might be easy to brush off as just bad luck or a weak immune system. Recurring respiratory infections. If you find yourself catching every cold or flu that goes around, or if infections like bronchitis or pneumonia become frequent visitors, it's important to dig deeper. Recurring respiratory infections can be particularly frustrating and exhausting. You might feel like you're just starting to recover, only to find yourself knocked back down again. This isn't just a series of unfortunate events. It could be a sign of something more significant, such as lung cancer. Why do these infections keep coming back? In the case of lung cancer, tumors can block airways, making it difficult for your lungs to clear out pathogens and debris effectively. This blockage creates a breeding ground for bacteria and viruses, leading to repeated infections. The emotional toll of constant illness can be heavy. It's disheartening to feel like your health is spiraling out of control, and it can be isolating to deal with one infection after another. That's why it's crucial not to dismiss these symptoms as mere coincidences or simple misfortunes. If this pattern sounds familiar, it's a wise decision to consult with a healthcare professional. It's not just about treating the symptoms, but understanding the underlying cause, which could be critical. Early recognition and intervention can lead to better outcomes. Remember, your body is communicating through these repeated infections that something isn't right. Listening to these signals and seeking advice is not only a proactive step in managing your health, but also an act of self-preservation. Let's respect these messages and take action to ensure our well-being. Number 6, coughing up blood. Moving on to a symptom that definitely raises alarms, coughing up blood. It's one of those signs that can be quite shocking and understandably so. When you see traces of blood in your sputum, which might look like rust-colored or bright red streaks, it's a clear signal from your body that needs immediate attention. Coughing up blood, medically known as hemoptysis, is not something to take lightly. It could range from small amounts to larger, more noticeable quantities. This symptom might bring a wave of anxiety, and it's completely normal to feel scared. The sight of blood is a powerful indicator that something unusual is happening within. Why does this happen? In the context of lung cancer, this can occur when a tumor grows in close proximity to any of the lung's blood vessels, eventually causing them to rupture as the tumor expands. It's also possible that the constant irritation and inflammation from a tumor can lead to this bleeding. This symptom not only affects your physical health, but can also be emotionally draining. The immediate fear and concern that come with coughing up blood can impact your day-to-day life, leading to stress and anxiety about your overall health. If you or someone you know experiences this symptom, it's critical to seek medical evaluation as soon as possible. It's one of those signs that you should never ignore, as timely diagnosis can lead to more effective treatments. Remember, your health is paramount, and responding swiftly to such serious signals can be crucial. Let's not allow fear to prevent us from seeking the help we need. Understanding and addressing the cause behind coughing up blood is a vital step in taking control of your health journey. Number 7, fatigue. Let's now explore a symptom that many of us might easily overlook: fatigue. Fatigue in this context isn't just about feeling sleepy after a long day. It's a profound, persistent tiredness that doesn't improve with rest. It's the kind of exhaustion where you wake up feeling as tired as when you went to bed, impacting your daily life significantly. When we talk about fatigue related to lung cancer, it's often due to your body working harder to compensate for the lung's decreased efficiency. The energy demands to maintain basic functions when your lungs are compromised can leave you feeling constantly drained. It's not just physical, it can wear on your emotional and mental state as well. Why does this happen? Lung cancer can cause fatigue for several reasons. For one, the cancer itself might be consuming a lot of your body's energy. Additionally, if your lungs are not able to supply enough oxygen due to tumor growth or blockages, your body has to exert more effort to get the oxygen it needs, which can lead to fatigue. This type of fatigue can be particularly challenging because it's often subtle at first and can be mistaken for normal tiredness. However, when it's unrelenting and profound, it's a significant sign that something may not be right. If you find yourself constantly exhausted without a clear reason, it's important to listen to what your body is telling you. Consulting a healthcare provider can help uncover if there's an underlying issue, such as lung cancer, that needs addressing. Addressing fatigue is not just about improving quality of life. It's about recognizing and responding to a potential hidden message from your body. It's a call to take your symptoms seriously and to seek out answers. Let's not brush off persistent fatigue. It deserves our attention and action. The most important point here is how crucial it is to pay attention to these early signs of lung cancer. Recognizing and reacting to these signs quickly can save lives. Early detection is key because it means doctors can start treatment sooner, which greatly increases the chances of beating the cancer. Let's quickly review the 7 early signs of lung cancer we talked about: persistent cough, changes in breathing, chest pain, unexplained weight loss, recurring respiratory infections, coughing up blood, and feeling extremely tired all the time. It's really important to keep an eye on your body and notice if something doesn't feel right. If you or someone you care about is showing any of these signs, please see a doctor as soon as possible. It's better to be safe and get checked out. Also, share this video with friends and family. Spreading the word can help others be aware of these signs too. Let's help each other stay healthy.